survive in this environment, 100 years in the middle of the city, in the middle of Detroit, where people are uninsured, don't have money, and have access to some of the best physicians in the world, that's why I think it's significant. 100 years is a success story.
Henry Ford and Detroit. The connection of this hospital to the city has proven to be critical to both. From the very beginning, the hospital helped to assist a city in desperate need of care. Over the century, the size and diversity of the city has helped the hospital become one of the premier centers in the country.
It goes back to my great-grandfather, and I believe that he had a vision that being the automobile capital of the world, Henry Ford Hospital, or his vision of Henry Ford Hospital, had to be in the city of Detroit. The health care of the employees and also of other people in the community was important for my great-grandfather to continue with the health care and the survival of Ford Motor Company.
I think being in Detroit is absolutely at the core of who we are, in so many different ways. And I'm so proud of the fact we never wavered in that commitment, not once. But if you think about it, I mean, this community, its diversity, what that allows us to be in terms of the clinical care we provide, the academic research we provide, the medical education we provide, is absolutely tied to our presence in this community. People come here because they know they are going to learn the most. They know they are going to practice and continue to improve in an environment that's very challenging to them. That's why our people are so amazing here, is because they are, it's not for the faint of heart to work here. And the people we attract are not going to go just anywhere. They want to come here.
Throughout the last 100 years, there have been significant challenges, riots and economic hardships among many others. But these challenges created an even tighter connection between Detroit and Henry Ford. With collaboration, work programs were established, new care facilities were opened, and nearby blight was eliminated. Thanks to these efforts, the city's health and well-being is much brighter, and the bond of the city with this hospital is stronger than ever.
We've got some challenges now. We will get through them. The business community is not walked away from. So what does all that mean? It means that this is going to be a very successful urban city. The city of Detroit needs Henry Ford Hospital. Henry Ford Hospital will be here for the city of Detroit.
Henry Ford has never forgotten that it started in Detroit and owes its past and future to the people who live in this region. And I found that very attractive too. Through thick and through thin, this organization has a heart and a soul.
I'm proud of what we represent. We represent what's good and right about healthcare, and we represent what's good and right about organizations that are participant in urban environments that are distressed. And I'm just proud to be part of that. I'm proud to be part of an organization that has that type of social consciousness and awareness.
You know, I feel that Henry Ford has made its mark in the city by staying here in the city, servicing the community, and and changing with the city as the complexion of the city changes.
If you grow up in healthcare, you grow up in, the operative word there is care, right? And so you grow up in with the thought that you should care for people. And our presence here in the community, our continued presence in the community, really exemplifies that. The fact that this community was not abandoned, that we have figured out how to deliver extremely high quality health care to the community in a very challenging environment. A lot of other systems have failed where we have succeeded. But one of the reasons I stay is it makes me proud that we were committed to the city and committed to the idea of health care for a population and didn't, quite frankly, take the easy way out.